So I'm going to introduce and pass the mic to Jared. I don't know exactly when we first probably spoke about Totally Outright, maybe like 8 months ago. And I remember Jared sort of, we were talking on the phone and he was like, I don't really know what to do exactly. Like, I need to figure this out. And Jared pretty much single-handedly took Totally Outright as a concept in Winnipeg and made it into a really successful and great program that I was lucky to be at for the first weekend just a few weeks ago. And Jared they just finished their first sort of full Totally Outright program, and it's really exciting, and it's really interesting too. And you'll probably hear this, but to hear how this story sort of repeats in the different cities where it's gone. It's a very similar story, very similar experiences, and it tends to work towards the same direction. But and each one is a little bit different too, which is really great. So I'm going to pass it to you, Jared, and we can hear from you.
Thank you. Good morning, everybody. So, full disclosure, I made this PowerPoint presentation last night. So, if it doesn't make sense, or if there's too many words, or if you have questions, just, deal with it or ask me later. I'm really happy to be here today. I just want to preface this by saying that my first entry point into the field of gay men's health was last year at the summit. So thank you to the organizers and all the people that participated, because I went back to Winnipeg with a real sense of purpose that I think I've been able to apply to my educational goals and my work. So that's valuable, and I hope that happens for other people who come to the summit too. My name is Jared Starr, and I work at the Rainbow Resource Center in Winnipeg. And for those of you that don't know, it is the longest continuously running LGBTT center, at least in Canada. It's been happening for about...
Enlarge your slides, you can do it right there.
If I want to what?
If you want to enlarge your slide, you can just... You don't have to, Jared, sorry.
Bingo. Sweet. Thank you. So longest continuously running LGBTT center in Canada that started on the University of Manitoba campus. And I coordinate the youth program there, and the youth program primarily offers a drop-in program for LGBT youth ages 13 to 21. But since I started, we've sort of just been growing the youth program to provide a lot of direct and indirect support to GSAs in high schools. I don't know if all of you know that Bill 18 has just been passed in Manitoba, and that legislates gay-straight alliances in high schools in Manitoba. So if a student comes forward and says, I know, whoop, this thing is on wheels. Holy shit. Anyway, so yeah. This thing's on wheels, just so you know. So that's successful. So, whenever there was a question from the media or from even the government about, what gay youth are doing or what they need, it would always end up on my desk. So the past year has been very, very, very busy because, that's just a lot to deal with. So I want to start by talking a little bit about the state of affairs in Winnipeg. So to give you a bit of a perspective on why we felt Totally Outright would be helpful, why we decided to run the program, how we adapted it to meet the needs of the young LGBTQ population in Manitoba specifically, and what our experience was and what the positive outcomes were. And yes, we did just finish the program on Sunday, so everything's still very fresh. So hopefully I can kind of share some of that awesomeness with you through the pictures. This is one picture. You'll see pictures throughout. They'll start to make sense when I get to the part about what happened. So just take a look at that. So the state of affairs in Winnipeg, just to give you perspective, in 2012 there were 56 new cases of HIV transmission in Manitoba, and 10 were through MSM transactions, like MSM interaction, which accounts for 18%. And I mean, while some people might say that that's very low, that's still overrepresentation, right? That's still overrepresented amongst the population, so it still is a problem, but it sort of starts to paint the picture, right? The proportion of new HIV MSM transmission has been decreasing since 2009, so it went from 23%, I think, then to 21% in 2010, 18% in 2011, and then 18% in 2012 as well. So, new cases actually are primarily amongst Aboriginal people, followed distantly by intravenous drug users, MSM following that, and then newcomers to Canada where HIV is endemic, where they're from. I was like, that doesn't make sense. And currently this year, what's sort of hot off the press now is that to date there are 40 cases of syphilis, which is more than double what we saw last year, and Public Health has officially declared this an outbreak in Manitoba. And actually, what they've done is they've attributed this to Grindr, which is interesting. They've attributed it to the kinds of sex that guys are having, and that it's happening via, social media means, and that it's unregulated and it's very risky and all that kind of stuff. So this is sort of what's happening in Winnipeg right now. Furthermore to that, In terms of chlamydia and gonorrhea, youth are the biggest priority group. So this is right from the WRHA, Winnipeg Regional Health Authority. The overall priority populations, according to the Healthy Sexuality and Harm Reduction Unit at Public Health, are youth, followed by intravenous drug users, then MSM, then incarcerated folks, and then folks who are street involved, and then newcomers, and then sex workers. So those are priority populations, which is kind of vulgar to break them out into categories, but that's sort of how they see it from their end. And to add on to that, there is a huge lack of sexual health education that reflects the behaviors amongst young gay men, which I think is pretty consistent in most prairie cities and smaller rural areas. Sexual health messaging that reflects young gay men has completely halted. So earlier this year, we had something called the GLBTT Health Promotion Coalition, which was started in Winnipeg some years ago, and they did a lot of campaigns about sexual health. There was getiton.ca. They had the Bud Doll campaign, so they had this sort of like, sex doll guy and lots of messages around condom use. And it folded. So basically, there's no sexual health messaging whatsoever targeted to young gay and bisexual men at all, like in Manitoba or Winnipeg, like at all. There's also no outreach being done, and there's no health promotion whatsoever. We do have the Gay Men's Health Clinic in Winnipeg, which is now being sort of revitalized into our own health center, which is supposed to be or which will be, I should say, a holistic healthcare center for gay men. And that's sort of, the balls are kind of in the air on that one, because we're still sort of determining who's going to replace Dr. Dick Smith, who was involved in the Village Clinic many, many, many years ago, and I'm sure many of you have heard of him, but that stuff still isn't for sure, and funding is always a challenge, and like, that's it, really. So we know that this can lead to a lot of problems, right? Like, I mean, if people think that HIV transmission is going down amongst MSM and there's no sexual health messaging and there's no outreach being done, like, what does that turn into? Like, that turns into huge increases in transmission and a lot of crappy stuff. Like, it can get really serious. So why Totally Alright made sense for us is that 1 year ago, here at the summit, we met with Wayne from Health Initiative for Men and talked about Totally Alright a little bit. We were able to secure funding from that former GLBTT Health Promotion Coalition, and unlike the AIDS Committee of Toronto or efforts here in Vancouver, our funders were actually very excited to fund the program. Like, they were like, do it, like, just do anything. Like, we get that there's nothing happening. We want something to happen. And I think we wrote a one-page proposal. It was kind of sort of really shoddy, and we got the money. And I mean, we have allies in government, so we're lucky in Winnipeg, where I think that our funder was, it has a relationship with the center, and he's part of, like, so there's connections already there, and a lot of that energy from the Health Promotion Coalition still existed, so it wasn't difficult to say, like, this works, we want to do it here, and they were like, for sure, go for it, which is really exciting, and I think that they're pretty keen on funding it again, and if not, we'll figure out a way to do it, so I'm not really worried about it. So we wanted to address, like, based on Winnipeg's population, we looked at the Toronto program and we looked at the Vancouver program very carefully, and we noticed that Vancouver was it seemed very academic, it seemed very knowledge-based, it seemed very, like, kind of rooted in the community already. And then the Toronto program, we noticed, was through the AIDS Committee of Toronto and had a very strong focus on HIV and skills, which were the two differences that we noticed. And what we tried to do was put the two together in a way that made sense for our population, realizing that the guys in the program aren't going to come in with a foundation of knowledge to be able to sort of sift through this stuff, and that even their own identities are still forming, and they need to understand their social location based on what's going on in their city and their environment. And drawing from, like, my own experience and the experience of the guys that we worked with on the committee, we came up with a curriculum that made sense for our folks. And I mean, we were really just sort of testing it. Like, a lot of this stuff was like, let's just run it and see if it works. And through a lot of conversations and consultation and a lot of support from folks from Toronto and folks from Vancouver, like, we kind of pulled it off, and we think we did a really good job. So going into it, we wanted to, provide some sexual health education for these guys, like, give them a safe space to talk about the kind of sex that they're having. We wanted to deal with isolation amongst young gay men, and we know that in our community, there's no, like, Davie Street or Church and Wellesley. Like, there isn't a designated gay space where young guys can go and meet each other. Like, there's the spots, but we wanted to create that environment so different pockets of young gay men would have the chance to connect with each other and form relationships, and it not be like in a dangerous public space or like a coffee shop. And Winnipeg isn't that bad. Like, there's some neighborhoods that are great, but we noticed that there was guys in corners and they weren't connecting with each other. There was, like, pockets of populations that went to the bar and kind of like cliques, but I don't want to, like, that kind of sounds a little juvenile. Like, I think it's more complicated than that. So we wanted to, like, address that in some way and bring the guys together. There was, or there is, and I'm sure this is common in a lot of places, a lack of intergenerational learning, role modeling, and mentorship. So we wanted to make sure that the program reflected, you know, out and proud gay men who are experts in their field, providing education to younger guys to facilitate sort of a process where there's some connections building there. There's also a lack of awareness to a holistic approach to healthcare, specific to the social and ecological factors that impact young gay men. And this is just like black and white in Winnipeg, where young guys have barriers to accessing healthcare. They can't talk to their doctors. They have to sort of educate their doctors. They don't see a doctor. There's no general practice. And like connecting all of the mental health and social health and all that stuff together for these guys is like foreign. So we wanted to really like build that within them and kind of teach them how to think that way. Also, targeting internalized homophobia and racism, and an overall lack of community engagement. And those are just some themes that we address specifically, but it speaks to a larger problem, right? So, thus, Totally Outright in Winnipeg was born. We had huge support, like I mentioned before, from the Vancouver and Toronto, and we were very appreciative of that. I think many phone calls went out to Jody Jollymore and Len Tooley, where I was like, I have this crazy idea, and I just want to know what you think about it, or I don't really get the group work thing, like what's that about? And I did a lot of research. I filtered through a lot of spreadsheets and data, read the manuals, all that kind of stuff, and really, without their support, it wouldn't have turned out the way it did, and I know that, so thank you. And like I mentioned before, we compared both programs and how we adapted. So this is how we made specific changes to Winnipeg. We combined both versions. We wanted a nice balance between practical skills and knowledge. We figured we would just take the best of both. Like, we'll just start with that because it's not heavily focused in one, and we can kind of combine the two. That way they walk away with some skills or some knowledge or both, and that's a bonus. Like, that's great. We worked from an intersectional and social ecological approach to raise consciousness amongst these guys, so that they could identify their own social location as it relates to like various spheres of influence. Like, we really just wanted these guys to be able to put themselves on a map in a way that made sense in relating to the world around them, and have concrete ways to identify that, which I think we accomplished because these guys really started to get it towards the end. Specifically though, from the two most recent versions of Vancouver and Toronto, we added a session about two-spirit identities and culture to reflect our community. Manitoba does have a very like high proportion of Aboriginal people, high Aboriginal population, and at the center, our values and our mission, we support two-spirit people. It's written into everything that we do, and we try really hard to make sure that our practices reflect you know, cultural competency and that we engage young Aboriginal youth. So we included two-spirit in our publications. We included two-spirit in our website. And we actually actively tried to engage two-spirit members of the community, which can be difficult because at the resource center, it's sort of, from that perspective, it's sort of seen as like the white people's resource center, and there's a divide in Winnipeg that I think is prevalent all over Manitoba, but we tried to work with that. We identified what intersectionality of oppression meant specifically. Like, we did a whole session. Actually, Darnell, who's a social worker in Manitoba, did a presentation called Gay Squared, and it was this beautiful photo journey of his experience moving here from the Philippines and dealing with being gay and being from the Philippines and being in Canada. And he did it by telling a story through images, and we had him adapt that for our guys, and it was beautiful. So that was very successful. We taught nonviolent communication. We also taught the Manitoba perspective of the gay health movement and then how that related to what happened globally. So we had a nurse who had been working in Manitoba for a very long time with the Village Clinic when it started, and he told the story. He told the historical, political story, but he also told his own story at the same time. So these guys got it, which was very, very helpful. And we just started with like foundational topics like what does it mean to be gay? Like just having a conversation. Like they'd never had that conversation before. And gay sex, like, you know, safe ways to talk about gay sex, what kinds of gay sex exist, what are the messages we see about gay sex, like just to start the conversation. We also developed a Winnipeg brand, and we felt that this was really important. We had permission to use images from Toronto, we had permission to use images from Vancouver, but we really felt that the images from Toronto reflected like cartoon caricatures of guys, and when I looked at that picture, I didn't really see myself in that picture, and I'm 26, so I'm at the top of that 18 to 26 bracket, but I knew that the guys in the program might feel alienated from it if they saw an image of a person that didn't reflect who they were or how they saw themselves. So we took all images of guys right out of the equation, and actually that went through a long process of having images of guys and seeing that was like, that's gay for sure, and then realizing that like, well, that's not all the gays, so let's just make it Winnipeg based. And that was successful. And also to promote the idea of a young LGBTQ community of men in Winnipeg. We included trans, queer, and two-spirit, like I mentioned before, in the literature, and tried to remain consistent with that, even though it became easier to say gay and bi at the end of the day, but the message was inclusive. We worked with the Winnipeg scene and conducted outreach in the bars, which is really, like, between doing bar outreach and university and college outreach and putting up posters, that was it. Like, we don't really have a lot of venues. We couldn't do, surveys on Davie Street. Like, we don't have that. So we were like, let's go to the bar, let's go to the universities, we'll have some kind of interactive activity, and I'll show you pictures of that, and it worked, so. We changed the field work and the group work components, and I'm going to show you sort of the success of doing that at the end of this presentation. In Vancouver, they do a field assignment where they go out into the community and they survey and they poll, or they'll do work for other organizations to get experience doing that. And in Toronto, Ricky, what do you do for group work in Toronto?
Can everyone hear me if I just talk? Okay. We actually we don't do a fieldwork component, and our reasons for not doing that is because when we have folks who do go out and do outreach, they're technically either ACT staff or volunteers, and they go through a very comprehensive core skills training program. But the Totally Outright participants don't necessarily go through that program, even though they get different kind of training. It's not the same. So just in terms of keeping consistent with the organization, we don't ask participants to do outreach in that sense. But they have come out to, for example, this past summer, ACT did a beach outreach event at Hanlan's Point, the nude beach in Toronto Island, and a lot of the Totally Outright participants were there just to hang out. But doing actual field work isn't something we do.
Yeah, so thank you. We knew that we couldn't send the guys out into the community to do surveys. That wouldn't even necessarily be safe, and it wouldn't make sense in the bars. Like, the bars are loud, and it just it was weird. Like, even us going to the bars to do like interactive activities about sexual health, which you'll see pictures of later, was strange. Like, the guys were like, "Why are these guys here?" And it was a struggle to try to like engage a conversation. So we gave up. We just gave out condoms and wore the T-shirts, and that seemed to be good enough. Handed flyers out to drunk guys, dodged piles of puke on the floor, and then just left. Right, which I think was successful because we were visible. Right, so our very basic goal was just to be visible in the community, because we know that it's going to build over time and that we are literally starting with nothing. So everything that we've experienced is a success in that regard. I'll get more into the group work project when we get there. So here's a snapshot of our website, just to give you an idea of what we did. We actually work with a graphic designer in Winnipeg who's phenomenal, and she empathized with the program and was like, "I'm going to do all of your work for you for relatively cheap," which was fantastic. So we had a website, we had a very comprehensive marketing strategy that we're going to carry forward into future programs. This is just one version of it. So on the right, you can see we have the Esplanade Louis Riel, which we all call the Penis Bridge, which is a Winnipeg icon. In the background, you have like a sort of a filter. Makes sense, right? We have like a filtered image of some of the buildings downtown. Our Exchange District is famous for having, like old buildings. I don't know how to say that. They're beautiful. Like, it's beautiful. It's a beautiful place. If you go to Winnipeg, go to the Exchange District. Not at night though. And here's our poster. So we kept the language, and we made sure that gay guys was highlighted as being like the punchline. And then on the bottom, you can see the Winnipeg cityscape. It was funny actually, in the applications we got online, there were a few applications from guys who identified as straight or bi-curious, and it's because they just wanted to meet other people. So that was an opportunity to connect them with other resources. But really, this worked. Like, guys were like, "I want to meet young gay guys. Like, what the heck? How do I do this?" Because in Winnipeg, it's like, if you don't do it at the bar on Grindr, it doesn't happen. So a lot of guys really want that. So that's the poster. That was the logo that we decided on. I could explain the journey that we went through to get to that design, and it's long and complicated, but we just settled with that, and we'll change it in the future if the program requires it. These are our T-shirts. We wore these T-shirts out the night that we did the bar outreach, and we also gave guys T-shirts without the back printing, just the front printing, as a gift for completing the program. We got them really good American Apparel T-shirts. They liked them. They're not just going to throw them out or use them as rags, or hopefully not. But that was the goal. This is our Facebook group. We always struggle. At the Rainbow Resource Center, we all have a lot of things going on, and it's difficult to engage social media in our work. Like, we actually were looking at hiring someone just to do that for us, because to spend a lot of time on Facebook, like with the amount of stuff happening, makes sense to do it, but it ends up being the last thing that we do. So it's something we're working towards, but this is the start. So that's our Facebook page. It was pretty good. I mean, Facebook gives you like stats about like what worked and what didn't. I'm gonna whiz through the rest here. I don't want to take up too much time. So this is our Facebook, or this is our event in one of the bars. We had 4 questions about blowjobs. We were going to do fellatio feud. We were going to do the family feud game, but we really didn't have time to pull it together. So it was really just a way to start a conversation in the bars, and that was plenty. That was super, super fun. And these are some images from the first weekend. We did a balance. Like, we couldn't afford to do a hotel for 4 days, but we could afford to do it for a couple days. So what we did is we started in the hotel. We did a wine and cheese mixer event so that guys could gel the night before, which was a huge success. They loved it. And then Saturday morning, we were right back in the same room at the hotel, as high up in Winnipeg as we could go, which was the 12th floor. And then we ended up on the Sunday back at the Rainbow Resource Center. So we called it community-based learning, because a lot of people think that the Rainbow Resource Center is where guys go to get help or counseling or whatever. And we were like, we didn't cross promote at all. Like, we didn't have our site linked up with Rainbow's site. We did everything as far from Rainbow as possible, and that was successful. And then over the course of the 2 weeks, we started at Rainbow on the last weekend, and then on the final Sunday we ended in the hotel. So it was sort of really special, and that was really important. Like, the inspirational venue is so key for us, right? We wanted to take guys out and be like, this is because you're important, we're paying for this, you're worth it. So here's a few images. And these are our guys, and they all gave me permission to show you, and they're very excited that I'm here talking about them, because now they realize that they're important, and I think that they are so important. So I'm sharing some photos. This is stuff at the Rainbow Resource Center. The group work component is really exciting, because what we did was we gave the guys a mentor who works in marketing and a graphic designer who works with that mentor, and we did in response to the lack of sexual health messaging, we gave them the tools to come up with a sexual health campaign. We figured that made the most sense, and then they could direct what they wanted to see in the posters or in whatever they did. And we told them that you could do whatever you want, and you'll have to do it in groups. So there was the group work component, but at the end of the day, we're only going to go with one. So at the end of the program, they had to discuss amongst themselves which campaign they would go forward with. They couldn't do them all, and there was a lot of value in that. There were some tough conversations. They self-regulated. The group gelled, and the group formed, and it was just beautiful watching them have this conversation. So I'm going to show you what the campaigns are, because they're super, super cool, because they decided what they were. I didn't even see them. Like, I kind of checked in a little bit, but I was totally removed from the process, and they came up with this on their own. And this was group number 1. So one theme that they decided was important was body image. And this one says, there's nothing like leftovers. And the whole campaign is to sort of play on the theme that, or the idea that, you know, you may not be the first pick, you may not be a prime cut of meat, but you're still worth it, and you're still beautiful, and you need to realize that. And really, the shock value is the part that's supposed to generate the conversation. And here are the guys presenting it. And if you'll notice this picture looks a lot like the pictures from Toronto and a lot like the pictures from Vancouver. And it's so eerie to see those pictures, because it's like the same thing. Without seeing those pictures, without it, like, it just sort of happened, which is creepy. So here was another way they looked at it. Look at this. They wanted these to be buttons or t-shirt logos, and this was going to be like their poster, right? And at the bottom it says, coming out is hard enough, even worse if you feel like you're not a first pick prime piece of meat, which is something that they'd all felt. So they wanted to see that message reflected back at them. The second one was about sexual health. They felt that they needed sexual health education, so they bought the URL secondpuberty.ca, and they came up with this snappy little logo, which was a condom, and there they are presenting it. And this was 2 versions of posters, and I caution you that a Grindr profile or a Scruff profile with a kid is a little bit, like, it begs a question, right? But when prompted, they responded to it, and they were like, no, we get that it perpetuates stereotypes about pedophilia, but this is our message, this is the shock value, and they handled the conversation so well that I was like, great, it's awesome. The whole message here, though, is that puberty sucks, you're awkward, inexperienced, and afraid to look stupid. Getting into the world of gay sex is pretty much the same. And that young gay men need to take the initiative to learn about what that looks like, because no one teaches them, right? Especially in Winnipeg. There's no intergenerational, there's no messaging. It's like, go to the bar and have fun, right? And then again, they wanted to do this, you know, you have a Grindr profile or a Scruff profile, but you actually feel like a young kid because you don't really know what you're doing. And that was the message. The third one, though, which is the one that they decided to go with, which was something that gave me goosebumps when I saw it and really shocked us, was shamelessness, the idea of shamelessness. And that shame, they had identified through all of that learning that shame had a huge impact on so many things and came from so many places, and that if you really wanted to start to be well, that you needed to address your shame. So they came up with don't let shame decide. And the rainbow colors are present in the word decide. It makes a ton of sense. And this campaign will go, like, we will run it. We are going to complete it. And if you're interested in picking it up, or you want want to adopt it or anything, just contact me because we really want to see it everywhere. I want to see it in every high school. I want to see it everywhere. So, and the guys are going to be part of that. Here's the first poster. It says, dance with him, don't dance with him, don't let shame decide. Goosebumps, right? Like, if you'd ever seen that anywhere in your life, do you think you might have thought differently about whether to go forward? And of course, there's things about safety and blah, 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 but at the end of the day, it's like, no, like, you know, who's making that decision? The second one was hold his hand, don't hold his hand, and don't let shame decide. And it's beautiful stuff, and we are going to run the campaign, and they're very proud of their work. And we are thinking of maybe adapting this, you know, broadening it a little bit, because you could run it in any population and any sort of thing. Like, it's a good campaign. Like, it's easily adaptable. So it was a huge success. These are the guys. This is the room, and thank you for hearing me talk.